How to choose the right IVF clinic. Now, most people, when they think about it, say, well, you know what? I don't understand much about IVF. I'm not an expert. I'll ask my doctor, and whether it's my family physician or my general gynecologist, they'll refer me to a good IVF clinic, and that's good enough for me. Others will say, you know what, we read this ad, or we went to this website, or we attended this camp, which was organized by an IVF clinic for screening fertility, and they were doing free consultations, which is why we went there, and they told us we need IVF, and that's the way we're going to do our IVF. Or I had a friend who did IVF in this particular clinic and got pregnant. None of these are good ways of selecting the right IVF clinic for yourself. Please understand this. Just because your friend got pregnant doesn't mean that you will, because she might not even have needed IVF in order to get pregnant, but the doctor just did unnecessary IVF and got her pregnant. And remember, every patient is different. And sadly, you can't even trust your gynecologist or your family doctor, because a lot of them will refer patients to IVF clinics because they get a cut or a kickback or a commission. They won't necessarily send you to the best IVF clinic. They'll send you to the one which gives them the biggest kickback. The only way to protect yourself is what we call information therapy, being well informed, exploring all your options. And there are two ways of doing this. One is called divergent thinking, and the second is called convergent thinking. With divergent thinking, you should keep all your options open. Don't worry about cost, geography, what the treatment, this thing. Just explore so that you know what your choices are. And after you've done this, and then you have enough information to make a well-informed decision for yourself, start eliminating some possibilities. So if I say, no, I can't afford to go abroad, or I can't afford to take holidays for so many days, or I can't take leave or whatever, and then create a short list of at least 2 to 3 good IVF clinics, and then interview them. And you only need to ask them one question. Do you provide photographs of embryos routinely to all your patients? And do you do only blastocyst transfers? And if the clinic says no, that's a red flag. Walk out and find a better clinic. And I think if you follow this simple process, your chance of finding the right IVF clinic are excellent.